Doctor, we have got a mail. Hi doctor, I'm from Kochi. I have heard about IPIL. How effective is the IPIL and are there any side effects?
Well, so far we have been talking about the methods to prevent a pregnancy, and we all know that it's not a very perfect world and mistakes do happen. So it's always good to know about what methods we can use to actually correct this mistake. Now, an unplanned sexual intercourse can happen anytime, and if you know that there is a possibility of pregnancy, or maybe say a different scenario that you were using a contraceptive like the condom, but probably it's not worked properly, and you would like to have a second method to prevent a pregnancy, there should be something which you could use. Now, in IPIL, or it's one of those brands of emergency contraceptive tablets which is available in the market. Now, unlike other medications which need a prescription, this is a prescription-free medication. That means anybody can go to a pharmacist and actually ask for a medicine without a prescription from the doctor. Because we know that by the time you realize that there is a problem, you go and see a doctor and then get a medicine, it might be too late. Especially with IPIL, where the medicine works best when you are actually taking it as soon as the event has happened. That means you take it between, say, now and the next one day, it works very well. And the longer you wait after that, the chances of it working becomes less and less. But still, if you take it, say, up to 72 hours, that's 3 days after the event, you still have an 80% chance of it being effective. So it works quite well in most cases. So it's still better than having no method. But if you've crossed the 3-day period, that means you have crossed 72 hours, it might be a good option to go and see a doctor, because they could actually give you other methods which are not as easily available as this one, which might work. For example, a woman can have a copper tip put in up to 5 days after a sexual intercourse, which might actually prevent a pregnancy. Now, you also asked me about side effects. That's something which you have been asking very frequently. Now, the IPIL, or the emergency contraceptive pill, works by preventing ovulation, that is the release of the egg from the ovary, or by making the lining inside the womb unsuitable for a pregnancy to implant. That means a pregnancy doesn't hold on after that. Now, when this happens, it might actually sort of damage the rhythm in your body, and you might actually have a period which might be slightly later than usual, or maybe a period which might be slightly irregular. And you know that if you have a delayed period, you would be always worried about a pregnancy, so which actually can cause a bit of anxiety. But nothing major, it won't cause a major medical problem. It's just those minor things which can actually worry you a bit more.
But I have the question here, doctor. As soon as you take the IPIL, will it lead to a bleeding tendency?
Well, it's very difficult to predict. It depends on when you're actually taking it. So if you're very close to your period, you might actually have a period immediately after that. Whereas if you're in mid-cycle, nothing might happen. You might just have a regular normal period, a period which is delayed by a few days, something of that sort.
Do they have to get a checkup after that?
Well, a woman can find out whether she's pregnant in a very simple method. It's quite as simple as taking this tablet, is by doing a urine pregnancy test. Now, that is what each person does when they want to find out whether you're pregnant or not. Now, the urine pregnancy test is a single-use disposable kit which is available in all pharmacies. So you go to a medical shop, ask for a pregnancy test, and you can get one of those. The instructions are very clearly given with each kit, and it uses a urine sample. It gives you a slightly more accurate result if you use a first morning sample, and that tells you whether you're actually pregnant or not. As long as the test shows negative, you can be very sure that the pregnancy is negative. If it turns out positive, that means when you get 2 lines on the kit, it tells you that you're pregnant.
Sometimes I heard people telling that there is a mild, second line has become very faint.
Well, the most important thing is you just have to say whether there is 1 line or 2 lines. Whether it's faint or dark is something which is not very important. So if you see 2 lines, you know that you're pregnant. If you see 1 line, it's not pregnant. Whether it's a good pregnancy, it's a healthy pregnancy, or what stage the pregnancy is something which you should not decide based on your pregnancy test. It is just to tell you whether you're pregnant or not. And only a further evaluation by your doctor or by a scan can you actually predict how good the pregnancy is or how many pregnancies you have.
Doctor, you have talked about IPL, and you said like taking after 3 days of sex intercourse, the failure rate is more.
That's right. It's recommended only for up to 3 days.
Okay.
It's best.
By chance, if she found to be pregnant after that, after taking an IPL, if she finds that she is pregnant, so how does it affect the baby?
Well, if you are pregnant and you have changed your mind about whether you want the pregnancy or not, well, if you want the pregnancy, it doesn't really make much of a difference, because the IPL just contains a hormone called progesterone, which is something which your body also produces. So it will not affect the baby or maybe make your baby more abnormal than, say, if you had conceived normally. But if you don't want your pregnancy, then you actually need to think about all the options which are there. And there are many options if you don't want a pregnancy. The most important thing is you should be very sure about what you want. I mean, being not clear about whether your pregnancy is needed or unneeded is something which you need to decide. And it's best that you decide it along with your partner about what the needs are and how you would like to tackle it. If you do want to continue with the pregnancy, which is probably the best option, because it's finally good news, is to see a doctor as early as possible so that he or she can actually start the proper care which a woman needs during her pregnancy and manage it appropriately. Whereas if you are sure that the circumstances are such that you cannot continue with the pregnancy, there are methods which could be either medical, that means you can have tablets, or surgical, where a procedure is performed under anesthesia to make sure that the pregnancy doesn't continue. And all this would depend on your medical background, any problems you have, and also the most important thing being how advanced the pregnancy is. It's much safer and more effective to go for a termination in which the pregnancy is quite early, whereas it becomes progressively more difficult if your pregnancy gets advanced.
So till what period a woman can take tablets to abort the child?
Well, if you are just taking a medical method, that means just tablets for getting a pregnancy terminated, it can be done, say, up to 7 weeks. 7 weeks means from the date of your period for 7 weeks. And after that, most people would go for either a medical method, knowing that the chances of failure are slightly higher, or maybe a combination of a medical and a surgical method. If the pregnancy is quite advanced, say if it's a pregnancy which has crossed the 3rd month and up to the 5th month, the procedure can be done only like something like a mini labor, where you actually give medicines for the woman to actually expel the pregnancy. And these should be done only at certified centers which have the extra price to perform a termination like this. In India, termination is illegal after the 5th month. That means after you cross 20 weeks of pregnancy, you cannot have an abortion done in India.
So doctor, you have explained very well about pregnancy and the contraceptive methods. It was really useful. Thank you so much, doctor.
You're welcome.
Hey girls, so you must have understood how important it is to be mentally and physically prepared before getting pregnant, because every child is a gift of God. So if you have any doubts, write to us. Our email ID is youthdairy@rosebowl@gmail.com. So see you next week. Bye.